Hey, welcome back to another episode of Clinic Gym Radio. I'm your host, Dr. Josh Satterley. I'm lucky enough today to be joined by the first female chiropractor on the show, Dr. Jen Reiner Marcello. How are you, Jen?
I'm great. Thanks for having me on.
Absolutely. Thanks for taking the time. So we are here at the Perform Better Summit, and Jen is a chiro who believes in the model of exercise as piece of care. I'm kind of interested in your early story. We talked earlier where everybody meets we either meet at a bar or at a coffee bar in the morning, right?
Of course, yeah.
And you and I were coffee bar.
Coffee bar,
yeah,
absolutely.
Which is equally as important, by the way.
It is equally important,
yeah.
Yes, I agree.
So can you give everybody a little history of where you graduated and then what you did right after?
Sure.
I think you got a great journey.
Yeah, so my undergrad was exercise physiology from University of Florida. So out of the get-go, I already had this passion for exercise and rehab, but I knew I wanted to learn more. And so I looked at the physical therapy track versus chiro, and at the time, chiro had direct access to care and a little broader scope. So I went the chiro route, but knowing that I really wanted to take more of a rehab approach to things and sports injury and those sorts of things. So
you wanted to do rehab, you just didn't want to have anybody else telling you how to
correct.
do rehab.
Yes,
yeah, okay.
yeah, correct.
That's good.
So went to Palmer West and graduated in 2006. And when I came out of school, I loved San Diego. I was already on the West Coast, knew I wanted to stay in California. Found a practice down that way where the doc was looking for an associate, and he had a golf background, seemed to work with a lot of golf athletes, was on PGA Tour treating and those sorts of things. So I thought, great, I could learn a lot from him in that regard. And worked with him for about a year and a half, and definitely gained some knowledge in the golf world, but gained a lot of knowledge and experience on the business side, which I think in school we don't really get a lot of that. So in that regard, I did learn a lot, but I definitely felt like I just hit a plateau in terms of learning with him. And with regard to the space that he had, it was kind of more of a typical office, limited to just, the table inside of a room. We had some tubing, maybe a TRX over the door, very minimal equipment.
But just to go back, what year do you think this is?
This is 2006.
So that's the year I graduated. So that was, if you had a TRX hanging and some tubing, you were
doing something.
At least mainstream, maybe a little ahead of the curve.
Sure,
yeah.
Okay. And I, through my undergrad, spent some time in the strength and conditioning world. So I definitely had some background in that as well. But the question was, how could I bring that into the rehab space, especially being so limited in terms of equipment and whatnot. So I did what I could with tubing and body weight and TRX, but like I said, kind of hit this plateau of couldn't go any further, at least where I was. So I was afforded an opportunity both at UCSD, University of California, San Diego, to integrate within their athletic training room and be their chiro on staff.
Nice.
And right around that time, Todd Durkin was also looking for a chiropractor. He had already had a physical therapist in his place, but he wanted a chiro just to round out his kind of wellness care that he had.
And for those of you who don't know Todd Durkin, runs one of the most exciting, popular gyms in San Diego, right? So this is the king of San Diego fitness saying, hey, I want to get somebody else on my team. Yeah.
A lot of athletes in there, but a lot of average Joes. So we had a little bit of everything.
Yeah.
And then obviously at UCSD, the collegiate athlete was what we were working with.
Yeah.
And that was great because for me, I thrive off of others. I love to learn from athletic trainers, physical therapists, strength coaches. I think there's just a world of knowledge between all of us, and the more minds, the better. So I loved being in that environment surrounded by other people where I could ask questions, watch what they're doing, integrate some of those things, and so that's where I really kind of found my space.
And interestingly, I'm just thinking you had kind of you had college-age athletes, right, that are all, 18 to 22.
Yep.
And then at Durkin's place, you had a few professionals, right? Drew Brees was working out there, LaDainian Tomlinson.
Yep.
And then you had the big group of just average Joes, right? You're 40 and above kind of working professionals.
40 and above, but we also had some youth kid, athletes in there. So kids that were figure skaters, 10 years old, some soccer kids, things like that. So we really did see the full variety.
Yeah.
And so it was great in terms of experience. And then also at Todd's place, as I said, we were really like on the floor with the trainers working together. There was a great continuum as far as when I finished my rehab care, they were already, introduced to the trainers that were on the floor, and they could then continue with them. And then, as I said, we already teamed up with a physical therapist. And with that physical therapist, we ended up creating a great synergy together, ended up opening 4 other locations in San Diego.
Nice.
Yeah. So we had a really great just community and variety of people that we worked with in San Diego.
So if I would have walked in any one of those 4 other offices in San Diego, is there any way I would have known if I was working with a chiro or a PT or anything? Was it all
That's funny.
Basically blended?
Yeah. People couldn't understand the difference between what we did. And sure. And when you drill down, sure, our approaches were maybe slightly different.
Yeah.
But for the most part, to the average person, they couldn't tell the PTs
You're just
from the
good.
chiro.
You're just really good at what you do, right? That's really what matters.
I think we all pushed each other. Like what conferences are you going to? What seminars are you taking? And once a month on Fridays, we would all get together and pick a topic, or if someone took a course.
Like all the locations would come together.
Yeah, we would all come together and share ideas.
Oh, that's awesome.
And then even invite the trainers that were at the various locations where we were to come listen to what we were talking about and maybe share their experiences on their end.
So you had the trainers working with you at Durkin's place, and then you also had trainers at these other 4 locations as well?
We did.
Okay.
Yeah.
Cool.
Yeah. The model was pretty sweet in that we set up typically inside gyms so that obviously the training equipment was already there, and typically we could carve out a little space for a couple tables.
Yeah.
So, and obviously...
Were they private rooms or just like, hey, I'm just putting the table on the floor?
It depended on the place.
But you were totally...
Yeah.
Just from a business perspective, when people are young, chiro or PT coming out of school, you don't need a lot of private space. In fact, yeah, I mean, most people in that world of, hey, I'm working out, are pretty comfortable with you already working with them on the floor,
Correct.
right?
Yeah. We, every once in a while we might have an older person or someone that, likes their privacy.
Yeah.
And we did have a little curtain set up that we could use in case, but for the most part, people didn't mind. And we treated it out in the open and
Well, you're in San Diego too. People are changing into their board shorts on the side of the highway and
totally,
you're driving by, right?
Yeah, absolutely. So I spent about 6 years between UCSD and Todd's place.
Wow.
And then ended up selling my practice to an intern of mine.
Okay.
And moved up to Stanford, got engaged for a little while until we moved back down together to San Diego. When my husband left Stanford, he decided to do some consulting work. And at that point, the physical therapist who I teamed up with said, hey, I have this great opportunity with the Padres. Would you be interested in being part of the rehab staff? And I said, great. And they actually already had a chiro on staff, which was nice for me because I got to sit more on the rehab side.
Cool.
And step in if the chiro wasn't there once in a while. But I really got to kind of hone in on the rehab and the reconditioning phase. Yeah.
You're like, oh yeah, I can do that too. I can adjust if you need it.
Yeah, if you need it. Yeah. Yeah, that's great.
That's awesome.
Yeah.
And so now take us through, so what year was that?
So that was...
You went up to Stanford and...
In 14.
You were, okay.
Yeah, 2014.
You said you were engaged for a little bit. You ended up getting married, not I was engaged and then I stopped engaged. But
yeah, I meant a little bit of time in up at Stanford as well.
And for people who don't know, your husband's in the high performance sports world as well, right?
Correct.
So yeah. We actually interviewed him yesterday, so I don't know what order this will come in, but so it wasn't like you moved out of the sports performance world. You're just moving locations because of an opportunity with a spouse, right?
Correct.
Yeah.
Okay.
Yeah. So you went up there.
Yep.
Little tiny university, Stanford. They're okay. And then you moved back down to San Diego.
Yep.
To basically work with the Padres and a bunch of other like pro level stuff, right?
Yeah. So I was primarily with the Padres during that time, and then ended up getting pregnant toward the end of the season.
But I know, but I teach rest stuff. I mean, there's video of you. I can't remember who you're working on, but at TPI, like some high level player.
Oh, was it?
And you just step into the frame for a second.
Funny.
Only because I know you. Yeah.
That's funny.
And then there's also if you ever have been to an SFMA course, there's a bald guy with glasses who has the worst active straight leg raise, and that's actually Jen's husband.
He's mine, all mine, ladies.
Yeah, that's right.
Yeah, he's a great project.
Yeah.
Great project to work on.
Luckily, he's a nice guy, but geez, you don't marry a guy for his active straight leg raise, let's just say.
No.
Yeah. So anyway, so now, what you tell us again, what year were you working with the Padres?
So that was 15, 16, I believe.
14, you went up to Stanford.
Yep.
15, 16, you came back for the baseball season.
Yes, yeah.
Okay.
Yeah, and then ended up getting pregnant toward the end of the season. And so just before the start of the 16-17 season, ended up taking maternity leave.
Okay.
So, yeah.
Cool.
And at that point, I had a real small I still had patients calling every once in a while wanting to see me, and they knew I was in San Diego. So I had a very small practice, again, inside of a gym, because that's where I feel most comfortable. Just seeing, roughly 10 to 15 patients a week.
Right.
Until it was time to actually take some time off for the baby.
Yeah. And along there, I'm sure there were different athletic conferences and this kind of thing, summits and presentations and assessment. I can't imagine, I don't know, if I was your husband, I had to assess a lot of athletes. I'd be like, hey, free labor, you want to go with me?
Yeah. For me, it's, my mind always has to keep going, right? I can never sit idle. So even when I was on maternity leave, whether it was just reading books or listening to DVDs I had, it was a good kind of time.
Jen actually read What to Expect When You're Expecting part 14 cover to cover. She read the whole series. Yeah.
Yes. Yeah. So I'm a bit of a nerd in that sense, in that I just, my mind's always craving new information, and it's a joy for me to learn.
Oh, man. Your kids it's a rough place for your kids, right? Yeah. You got two doctors as parents, and love of reading, and it's gonna be rough. Anyways, so you've seen a lot of different models. I mean, you've seen D1 universities in the training room and the performance side. You've seen private, I don't know what you want to say, establishing small private clinics within operating gyms. You've operated in a regular chiropractic practice.
Yeah.
So you've learned a lot. For that person that is, so there's kind of two groups that listen here. People who are in school and about to get out.
Right.
And then there's also the established chiropractor. They have an office, but they don't yet have the fitness component.
Right.
So would you mind giving some tips to either one of those people that are running with it?
Yeah.
So maybe let's start with the established doctor. Hey, I'm a chiropractor.
Yeah.
And I want to start doing fitness. Most chiropractors I know now, especially if they're listening here, they're doing rehab.
Right.
But I want to remove that fake wall of rehab into fitness.
Yeah, that's a good question. I think surrounding yourself with obviously people that know more than you, that you respect, is a great place to start, because you can't know and learn everything, especially if you're a new doc and maybe the fitness or the training side is new to you.
Yeah.
I would highly recommend hiring, one or two people that can take that on for you, but also that they also have a good understanding of the rehab side.
Right.
Not that they need to be doing rehab, obviously, because that might be something you're already doing, but that transition,
But there should be some overlap there, right? It's like those. Is that a Venn diagram with two circles that go across?
Yes, go across. Yeah.
You can take that person into exercise.
Correct.
But you're not necessarily specializing in that. They can take the person into rehab, but they're not specializing in it.
Right.
Okay.
Absolutely, yeah. And so I think, finding someone that obviously has the same kind of philosophy or mentality that you might have, so that the communication lines are open.
Great.
For me, it was FMS and SFMA that spoke volumes and just made a lot of sense. So most of the trainers that I worked with at least had had FMS certification, and then maybe they sat through an SFMA just to kind of understand where I was coming from. And that made just a smooth transition for patients. They understood that we had their best interests in mind, and we didn't have many trip ups of terminology or how to kind of go from rehab to training and vice versa. So I think most importantly, hire someone that knows what they're doing, has a similar philosophy to you, and again, open lines of communication.
Are you a chiropractor or physical therapist working long hours, worrying about lower repayments and missing out on quality time with your family? You can double your income without working more hours by adding a gym to your practice. Clinic Gym Hybrid Solutions has a step-by-step guide that dramatically simplifies and speeds up the addition of a fitness center and its monthly recurring revenue. In just 6 months, you can be on your way to freedom. Visit clinicgymhybrid.com today for a free downloadable PDF and complimentary consultation to get you started. That's clinicgymhybrid.com.
You obviously have some pretty good business acumen. You were running five offices
clinics,
at the time. And if anybody knows the distance from Todd's place, well, getting around San Diego wasn't like they were right next door to each other,
correct,
right?
Yeah.
That was a hurdle, I'm sure.
Yes.
So let me ask you this. So when you would take people from the clinic treatment side, into rehab, into exercise. I think some people are intimidated by having the conversation about, hey, I want you to continue exercise. How did that go for you?
I'm all about educating my patients, you know, and I always get some that don't want to, you know, they're not that interested. But I think for the most part, people want to learn why you're doing what you're doing, right? And when you explain
especially
things,
if they're in a gym, they're already saying, hey, I invest in my health, right?
Yeah,
so they're a little more educated.
Yep. So when you explain things to them of why you're doing that and why you're progressing in a certain way and why they need to continue doing certain things, of course you're going to lose some, right? Whether it be due to lack of funds or maybe they're just not interested, whatever.
Right,
but I think the majority of people, they want to continue to feel good and move well, right? And I've had those that have kind of fallen off the wagon, right? And then they end up coming back to your office because they're like, you know, I didn't keep up on this. And let's face it, that's life, right?
Right.
And I think they learn the hard way. And for a lot of those people, then they end up coming back to you and then obviously continuing on with the training. Doing something along those lines. So I think it's about patient education. And sometimes, like I said, it's them figuring it out for themselves in terms of falling off the wagon and maybe some of their things start to come back.
You're just too nice to say, ha, I told you so, sucker.
Totally. Yeah. Some I do. Some I do. Depends on the personality.
Say I'm the best. Say it. Say it, or I'm not treating you.
Yeah. So yeah, I think it's about patient education and then...
And can you dive into that just a little bit? Like, so would you educate people and say, like, now, I'm going to treat this and we're going to get that hip extension cleared up, and then I want you to keep working on that. Like, how would that education go? What would you try and...
So I think learning the most you can about that patient, meaning what is their goal, right? Do they want to be running marathons? Is it just about playing with their grandkids?
Sure.
Whatever makes their clock tick, I think that's the level that you have to get on with them and make them understand, here's what's going to happen if you don't do some of these things to keep you moving well.
So you would piggyback on their performance idea and back that up to here's why we're doing that.
Correct.
Okay.
Yeah. And I think when you break it down enough to say, here's what happens to the body over time if you're not doing these things, right? You go back to your daily life of sitting behind a desk or whatever it may be. I think then the wheels start turning and they start to understand, okay, this is why we're doing it. It's not about a money scheme that they just want to continue training and make money. It's here's what happens as you age. Here are the things that I want to keep doing to make me happy. I have, and therefore I need to be putting in this sort of effort and time.
Yeah. I think it probably you came across that fairly easily because when you're working in, for example, collegiate sports, you had crew there, right? Like and they're probably very concerned with shoulder health. Yeah. But your, cross country runners don't care about that, right?
Of course. Yeah.
And so it's like, well, you have to do this to run faster, or you have to do this to row faster.
Right.
The goal is different, but in either one of those people with a thoracic spine problem, they don't, they want to know why thoracic spine will affect them.
Correct.
And if you talk to the runner about rowing, they're going to be like glassing over and saying, I don't care about that.
Yeah. Find what makes them tick. Yeah. And use that as the motivation tool to keep them going.
Yeah. My point with that, like, I think sometimes when we get into general population, like when you were at Durkin's place and, you have the 45-year-old mother who's working out and, it's worth the conversation to find out, like, what is it that motivates you? Is it this workout itself?
Right.
Maybe that's what she attaches to, or is it, you have a dog you like to walk. Like, I was always surprised by how many women would say, like, I want to walk my dog without pain. I'm like, what?
Right.
But that, I think, was their time to kind of get away and, or is it like, not having pain when you're doing whatever sport you love? Oh, I also love to, play Frisbee golf, or I don't know,
Yeah.
But I think in the general population, we think, oh, you just want to be out of pain. And even there, it's like, it's not just out of pain. Like, for a lot of people, even if I get you out of pain, that's not enough. I want to also perform X very well.
Correct. Yeah. Yep.
But in sports, it's inherent. So I'm going to think about that now as I kind of go forward. Because discovering that end goal is important for everybody.
And with athletes, it's funny. I mean, you'd automatically assume that they'd be motivated enough, that every athlete's motivated to want to do your rehab program, and they're not, right? And even training. Like I found that with the Padres. It was so interesting that... I mean, I don't even, maybe 25-30% of the players didn't train with our strength guy. And I was like, what are they doing, right?
Yeah.
And it's just, they had their own mentality of what they wanted to do,
Yeah.
and they weren't motivated to do certain things. They played baseball and that was it, and they wanted to kind of stay on their own track.
Yeah.
And those were the people that were hard to make them appreciate what you were doing and what the strength coach was doing. And oftentimes it was talking about, like, it's not just how well you play now, but you want the longevity of your career, right? Well,
Yeah.
here are the things we need to do to make sure that these joints are moving well and that these muscles stay doing X, Y, and Z.
Yeah.
To make sure that you can continue to play. It's not just making sure that you're the MVP of this year.
Right. Yeah, because longevity is so important. It's funny when you work in different sports. Like, I mean, golf for a long time, the thought was, oh, don't work out because
Right.
you're going to get tight,
Right.
And then, luckily that has faded. I can't think of, on the leaderboard of the PGA Championship just happened. I was asking somebody, how far do you have to go down the leaderboard to find somebody who doesn't aggressively work out every week? But the other side, like, I have a friend who's a big swim coach, and I said, hey, what do you do for dry land training and this and that? He's like, well, we do weights on Mondays and Tuesdays, but I don't want him to get tight by Friday. I'm like, oh my God, this is the same thinking.
It's mentality, yeah.
Yeah,
Same
but
mentality,
it's, how far behind is
Yes.
swimming, or how far behind is,
Right.
endurance sports?
Right.
Like,
In so many sports, whether it's baseball, gymnastics is a big one. That's where I grew up. So much of it is based on tradition and what we've always done.
Yeah.
And they don't care that our world has been studying this for years and years and years, and we have
Yeah.
all this evidence to say, well, actually, here's this.
yeah.
They just continue to have that mentality of, well, we've always done it this way.
Yeah, I know. And sometimes you can see the sacred cows that person has in their mind, and then you violate that, and they're like,
Yeah, right.
like in golf, the worst way to train to get better is to take 100 of the same shot in a row, because
Right.
that never happens on the course.
Right.
That only happens on the range. It'd be like,
Right.
I'm now the world's greatest third 7-iron shooter in
Right.
the world. It's like, that never comes up.
Exactly.
How would you change things if you go back and talk to if you were coaching 10-year-old female gymnasts? Like, what are some things you've learned along the way?
Yeah, it's a great question. Well, one thing that is glaring.
Well, because
to me-
you're a parent.
I know.
You have another one on the way.
I
so,
know.
And it's going to affect you. It's going to,
Yeah.
crawl around in your mind, right?
Yeah, I mean, just offhand, even where my daughter goes to gymnastics and I'm watching some of the coaches train. I mean, they're doing exercises from like 1985, and we just know more than that.
They're
The
that
other
cutting
thing-
edge? 85?
Yeah, right. Yeah, and I think running mechanics is a big one with them. If you watch the girls go on vault or floor, for
Really?
that matter, they have what's called a lot of backside mechanics. They need to be working with a track coach or a movement coach to understand actually how to run properly, but
Yeah.
you don't ever see that happening. And even
Jesus, I'd hate to be the coach for you guys.
Right? And even just understanding how to put force into the ground.
Mm-hmm.
A lot of them don't understand that concept. I mean, one person that does it beautifully is Simone Biles, and
Mm-hmm.
she's winning every single competition because she understands that concept. And some of the other things that I see within gymnastics is letting the ribs flare. Yeah, so much of what they do, whether they're finishing pose,
Yeah.
so many of their tricks that they're doing, their rib cage is coming out into the front, right? Versus keeping that rib cage in, but still being able to extend through the spine and not
Yeah.
just the lower back. So there's a lot of
Those
you know,
hypermobile lumbar spines and whatnot.
Totally,
With,
yeah.
I mean, you don't think about it, but I've seen not that many gymnasts in my life, but I've seen a few, and I'm shocked with how immobile their hips are
Yes.
compared to their global
Correct.
flexibility.
Yep.
But they have hypermobile lumbar spines. I'm just
Correct.
like,
Yeah.
your pars hate you.
Right,
Like-
exactly. Yeah, I mean,
Yeah.
so hip extension being a big one,
Yeah.
and hip internal rotation being another big one that I typically see
Okay.
in that population. So I think addressing a lot of those issues.
Hip internal rotation helps 10-year-old female gymnasts and 70-year-old male country club
totally, yeah.
golfers.
Yeah,
Like,
yeah. So I think just paying attention to some of those little things during the beginning stages of
Yeah.
the training will prevent so many issues down the road.
yeah,
So yeah.
that's funny. Hopefully you can change the world, starting with
Right,
your
I
kids.
know.
But
Yeah.
I go through the same thing. But luckily, we scored. I had an intern that helped us with a lot of exercise and athletics, and taught her everything I could in the junior programs that we knew about. And then she ended up opening a Taekwondo studio.
Oh, right
and our
on.
kids are students there.
Nice.
Yeah, so they do a good mix of like 40 minutes out of every hour is skill, and 20 minutes is just general athletics and
Yeah.
moving around. And
Yeah.
Excuse me, I love it. Yeah.
Yeah.
So last question, because I
Sure.
don't want to keep you too long, but the going back, if you could go back to young Jen, unmarried, no, you haven't taken any shots from business, setting up
Right.
businesses. You're coming out of school, you're excited.
Yep.
Moving to San Diego.
Yep.
In that first year,
Yeah.
what would you have done different, or what would you advise a young doctor
Yeah.
to do for success?
Yeah, and I'm going to say this, but I do think that the culture is changing, at least
Yeah?
in the chiropractic
Well,
world,
yeah.
and maybe even a physical therapy world.
You and I met at first in ART seminars, right?
Yeah.
And at the time, I would say that it was fairly progressive to have a good skill set of
Right.
soft tissue.
Right.
I would say that if you graduated last year, there's no question. You have to have
Correct.
something, at least
Yes.
like instrument, hands,
Yep.
whatever.
Yeah.
But at our time, it was like, man, you still, I remember traveling to go get them and
Absolutely.
certs and everything. And it was like, wow, I'm really on cutting edge. And now it's like,
Yep.
oh, that's nice. Everybody
Right.
has that now.
Right. So I think cutting edge in this day and age, this day and age, and this is what I would have done at a school, is having some sort of, obviously in school, you learn the medical diagnosis of things,
Yep.
right? But you don't learn the why, which is the functional diagnosis of things.
Okay.
So for me, SFMA was really the answer to a lot of those questions is why are we finding this? I don't want to just keep treating the pain. We need to treat the cause, right? And so for me, that would have been, I think, a huge eye opener. So finding some sort, and it doesn't have to be SFMA, find some sort of system that makes sense to you, but have a system that not only gives you the medical diagnosis, but also the functional diagnosis to give you some sort of roadmap to get that patient not only out of pain, but back to doing whatever it is that they want to do without falling back into your office again.
Yeah.
Yeah.
Yeah. The question I remember having as a young doctor was, how come when I treat, when I was chasing pain, for lack of a better term,
Yeah.
when I treat the pain on this person, they get better. When I treat that same pain with the same protocol on this person, it doesn't change or it gets worse.
Right.
It's like, what the
Right.
heck is
Yeah.
the deal here,
Yeah. And then the
Yeah.
other thing that I think is important is being open-minded to other philosophies as well. Like I've gone through a lot of the DNS courses. I've gone through a lot of PRI. I've done some more traditional.
Got to be
physical
careful with those DNS
therapy
courses.
stuff.
That's how you end up married and pregnant,
I know.
though. Yeah.
That's true. That's very true. But I
You
think,
never got pregnant from PRI. Just,
right.
no.
Let's be clear on that.
Yeah.
But I think being open to other philosophies and understanding that not every philosophy is perfect, right? There's what I call Swiss cheese in every philosophy, meaning
Sure.
there's holes, right? And I think the more philosophies and technologies that you learn and you're able to overlap those, the more you're able to fill in those holes. And then you're also able to see the similarities between some of those things.
Yeah.
So, for any one patient or client even that comes in the door, I may use an SFMA on somebody, but I may do a lot of PRI stuff with them as well, or maybe they're a little more on the DNS side. Each person that comes in your door, you need a separate toolbox and be able to figure out which tools are going to work for that person, because not one tool is not going to work for everybody, right?
So clinically, that's those are some perfect steps. And how about business-wise? Going from, in a 10-year span, going from brand new out of school to 6 clinics to
Yeah.
working with the Padres to,
Yeah.
you've seen in all those branches. What would you say in that first year? What would you, maybe you did the right things, I don't know, but
Yeah.
what would you suggest to that person that they're coming out of school in that first year? What would you suggest they do?
In terms of on a business.
Yeah, business
Yeah.
side. Because I think a lot of people now, I'll give you some time to think as this is, but a lot of people now have a great clinical skill set.
Yeah.
And the only thing is, as one of my mentors said, I can't teach you to swim standing on the deck.
Right.
You got to get in the water.
Yes.
And so
Yeah.
your clinical skill set's great, but remember, you're working on a healthy population of people interested in health. That's why
Yeah.
they're at chiropractic
Yeah.
college. You're going to get out and see some crappy tissue quality,
Yeah.
people who don't recover fast, who aren't sleeping, who aren't
Yeah.
doing all these things. I remember the first time somebody came to my office and was a smoker, and I was like, nobody in chiropractic college smoked, and I can
Right.
feel the difference in your tissue. I was like,
Yeah.
oh my God, you're allowed to
You
do
just-
that?
Right. You just got to kind of jump in.
Yeah.
Yeah. I think I do like the approach that I went through, at least, was to have a mentor,
Okay.
whether it's working under another doctor or
Yeah.
befriending another doctor who's been in it, and whether it's, paying them for their time or maybe just shadowing some of their front office staff for a little while to figure out how they do things. But another thing, same as is a practice in terms of clinically, is having a system. I think it was with the E-Myth that I read in terms of having systems within your practice.
Make pies, baby.
Yes,
that's right.
Totally. Yeah. Having a system of how you do things, and even having a manual, which was a big thing for me. When I was on my own, I wrote down how I did everything, whether it was from verifying insurance to scheduling patients to, you name it, I made a whole manual for myself.
My God, what is your home life? Because
yes, I'm type A.
No, come on. And that's only because there's nothing higher than A in our alphabet.
Right,
yeah,
I know.
But Brandon's the same way, right? Or
he's not as organized.
Okay.
He's not,
but it's like, find the best way to do it.
Totally.
And then repeat it.
Yeah, he comes up with phenomenal ideas.
I can only imagine the dishwasher in your house has
yes.
an instruction thing.
Yes, absolutely. But here's the thing: when you create a system and when you write it down in terms of how you run your place or your office, when you go to hire that associate, which is what I was doing with all the different locations, now you have a manual that you can give them, right? And they learn from that, not only training underneath you, but taking that home and reading it. And then when they are on their own and they get stuck, they have a manual there to refer back to.
I think, too, business-wise, confidence is
huge.
It's underrated when you get out of school, but if there's one thing you can maintain, it's confidence.
Yep.
And so the systems give you confidence. Like,
correct.
Do this every single time. And
correct.
Not that it has a 100% success rate, but I guarantee it's got a lot higher success rate than if you do it differently every time.
Right. And here's the thing. If you're doing it a certain way and you're finding out that way is not working, you obviously can go back to your manual and say, here's where we're going to change it, and this is why, and that grows along the way with you.
The easiest way to build a practice, most people come in, you're young, you're hungry, you're confident about what you're doing. They're like, I want to help you.
Right.
But if you doubt yourself, you doubt your methods, you doubt everything, and you're just not confident coming off to that person, they're going to be like, I'll go somewhere else.
Correct.
Yeah.
Yeah.
So I think that's huge. I'm sure you had some of that.
Absolutely.
Inherently.
Yes.
But there are probably dark days, right?
Oh, absolutely. I'd say I always say the first 2 years of practice, I want to go back and apologize to my patients. Yeah. Because it's a practice. You're learning along the way as you go, right? But at the same time, I most definitely lacked a lot of confidence. I didn't have the best manual adjusting skills. And so for me, I relied heavily on rehab side as well, but I also felt like I was lacking on the rehab side in terms of knowledge because we didn't get a ton of that in school. It was up to me to seek outside courses and whatnot. So I felt the more courses that I took, the more people that I saw, the more confidence I had each day, and I really felt like I was kind of firing on all cylinders. I'd say within 5 years of practice, I felt really good about where I was. Yeah.
The worst thing in the world is when you're a young doctor and everybody tells you, though, just give it time. Just give it time. It's like, shut up, I don't have time. Do something else. Yeah, that's good. And one, I don't know if you experienced this, but maybe it was your mentor, but if there's somebody you talk to that you inherently notice that you have confidence after talking to that person, freaking do that and do it every day, or have coffee with them every day or whatever it is.
Exactly.
I'll do that. I have a friend who, when I'm making big business decisions, I take him to lunch. I'm like, let me just bounce this off you. And he sometimes tears them apart, and then sometimes he goes, no, I think you're good here.
Right.
But I've learned that is a habit, or that's my system of, if this is going to be greater than a $50,000 or 1 year commitment, talk to him. It's worth the $50 for lunch.
Right.
Because I'm still not confident in everything I do.
Of course. Like, we're all learning.
Yeah,
along
and
the way.
it's funny, but I just think so many people are like, I'm gonna be the cowboy, and it's like, dude. Nobody's doing that.
Right.
I mean, at this conference, I keep hearing over and over, people that I perceive, Mark Verstegen, Mike Boyle, Greg Rose, as being the top. They're like, oh, I borrowed that from so-and-so. I borrowed that from there, and like.
Yeah, we all steal from each other at the end of the day.
So if you haven't stolen any ideas lately, you need to be around more people probably.
Yeah, so I think most importantly, whether you're in the fitness world, whether you're on the rehab side, surround yourself with people that know more than you so that you can pick their brain, take their knowledge, and hopefully apply it to whatever you're doing.
Nice.
Yeah.
Well, last part, you're seeing, you're in an incredible spot where you're seeing all levels of athletics, you're seeing all levels of rehab, you're exposed to some of the most cutting edge things. What's exciting you about being a chiropractor in the next 10 years?
Yeah, so interesting enough, I moved just about 4 months ago from San Diego to Sarasota to be closer to family.
Okay.
So what's interesting to me is I've always wanted to learn more about dry needling. And in California, we can't obviously do that due to licensing issues with California, but Florida does allow that. So I'm really interested in kind of diving into some of the dry needling aspects of things. There's always courses out there that I want to take and learn more. TPI actually being one. I've done SFMA probably 20 times, but not the actual golf side of things.
Nice.
So I think learning more specific to sport, whether it's the racket fit or TPI. So those things I'm looking into. And then I'm always picking Brandon's brain too. Not that I want to be that performance coach, but I need to understand what they're doing so that that athlete that comes in, I understand where Brandon's coming from and what they need to be accomplishing with them. So just learning more on the strength and conditioning side, performance side for me is always
there's two, I don't know if you know, there's 2 chiropractic universities in Florida now.
There are. I just learned there's a second one in St. Pete.
Palmer, Florida, and then Kaiser?
I think that's,
I was like, how come I didn't hear about it? It was like, oh, it's been around for 3 years. I'm like, huh?
I know.
Yeah.
Interested in checking
crazy.
that one out. So, so that's what's interesting me
Very
and
cool.
looking forward to learning more.
Yeah. And are you excited now versus when you graduated? Is it more exciting to be a chiropractor now?
I think so. Yeah. I think so. Because I think you gain a confidence in what your skill set is and that you feel like you can really help a lot of people when you get to a new area.
I think early on, like people, I don't know if you experienced this, so I don't want to put words in your mouth. Early on, when you graduate, a lot of people go, in the medical community, it's not, and maybe it's changed in the last 10 years, but you're a second tier, blah, blah, blah. But then you get into sports and it's like, people are like, are you good? You're like, well, I'm a chiropractor. Like, I don't care.
Right.
Are you good?
Right.
It's like, well, I'm a PT. Shut up. I don't care. Like, are you good? And if you're good, I don't care what your letters are, because they're like, we've worked with everybody, and all we care about is it's meritocracy.
Right.
It's pure meritocracy, which is awesome.
Yeah.
So you got to be good.
Right.
But if you are, then there's a lot of doors that open, right?
Yeah, I think, and that's, I think one thing that's challenging, this will be for the new grads, obviously in San Diego, I had a name, I had a reputation, I'd met a lot of people out that way, so referrals were easing and opportunities kind of came to you because people knew you. But now that I'm in a new area, it's no one knows what I do, no one knows my background, so it's starting fresh, and that's obviously what the new grads are experiencing. And so I think what you do is you put your head down and you do your best job, and you let the people, your new patients coming in, be your best business cards, and the word is going to get out, right? The more you educate your patients and you show them that you care, and you do a great job, that's how you spread the word. So it's a tough road, but just, do the best you can for you and your patients, and it'll speak for itself.
All right, cool. So if we have some listeners that are like, look, I'm intimidated, I'm scared, I want to do what Jen's done, do you mind if they reach out to you?
Absolutely.
Okay. How can they do so?
Yeah. So my email directly is Dr. J Reiner. It's REINER @gmail. I actually do work for a nonprofit organization that specializes in education, training, rehab for youth athletes.
Oh, really?
And so that's called Team Elite Cares.
Say that again.
Team Elite Cares.
Okay.
And that's there's our Twitter handle and our Facebook is just that, Team Elite Cares. So feel free to follow us. We're always putting new information out there about training, about rehab, things like that.
But it's specific to the youth athlete?
Specific to youth.
Awesome.
And then my standard Twitter is Dr. J Reiner, and that's specifically all business stuff, things I like to share in terms of what I'm interested in with rehab as well as training.
Cool. Awesome. Well, Jen, this has been a slice of heaven. I really appreciate the time.
Absolutely.
And very excited for you because, man, what a journey you've been on. And it sounds like it's going to get even better with this second kid, huh?
I agree. Yeah, thanks, Josh. Appreciate it.
Well, thank you. And for everybody out there, I try and say it every time, but I think Jen's done it. Go out there, maximize your license, and live the life you dream of.
Thanks for listening to Clinic Gym Radio. If you're ready to double your profit without working longer hours, please visit clinicgymhybrid.com and find out how easy it is to get started on your path to freedom. That's clinicgymhybrid.com.